Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Amir Malik bin Ismail and I am from class SR113A, and today me and my group want to demonstrate to you some exercise rehab for 3 common rugby injuries, that is ACL, hamstring strain and ankle sprain. Before that, let me introduce to you my group members. The first one is me, Muhammad Amir Malik bin Ismail. The second one is Amirul Azam bin Zuraidi Aminuddin. The third one is Amirul Azrik bin Muhammad Azhar. The fourth one is Ahmad Syakir Adham bin Muhammad Khair. The fifth one is Ahmad Khilfi bin Fahizat. And the last one is Ahmad Kamarul bin Mustafa Kamal.
Okay, hi, Assalamualaikum. My name is Amirul Azam. So now I will explain about the pathology, cause and effect of the injury. The first injury is ACL. The anterior cruciate ligament can be injured in several ways. First one is when the player changes or her direction rapidly. Change of direction is one of the main mechanisms of ACL injury while playing rugby. Despite the fact that rugby is a collision sport, many ACL injuries to the knee occur as a result of a change of direction without contact. This study established a relationship between change in direction without player contact and change resulting from the center of gravity and knee joint movement to study ACL injury risk factors in rugby players. Mostly if the player is fast, we will always do side step to the opponent. So if the wrong armpit step is done in side step, it will affect the knee and produce the ACL injury. Next cause is direct contact or collision, such as tackle by opponent. The most frequent mechanism of injury for all sorts of injuries was being tackled, and the median time to return to play was 1 day. The most time required to return to play was caused by the anterior cruciate ligament ACL injury. The median day is 236 days. The last cause for ACL is landing from a jump incorrectly when grabbing the ball from the air. After the kick starts, there will be a clash in the air between the opponents to win the ball. Then there will be jumps and landings. Jumping causes your knees to experience severe strain and strain, and it may also cause your shin bone to slightly spin. Your ACL may experience significant stress as a result of the rotation and strain on your knee joint, which could result in an ACL sprain or a complete tear. Sometimes players are unaware of the existence of opposing players who want to challenge them. With an error in terms of landing, it can result in ACL for rugby players. Next is the effect of ACL. Nobody but ourselves is to blame for ACL injury. It was always attributed to bad fortune, poor timing, or even both. The truth is that it was our own fault and that we might have prevented the harm, or at the very least reduced the likelihood that it would have occurred. Any ailment that requires recovery take time, effort, and a devotion to improvement. Recently, it appears that ACL injury have increased in frequency. However, it is also feasible that they are simply receiving more accurate diagnosis. So the first effect is the player will have to rest for a long time. For any sport, all athletes will avoid injuries that will take a long time to recover. This will result in them losing stamina, decreased self-confidence, and even game performance will plummet. The length of time an athlete's muscle will deteriorate is in a short period of time. If this happens, it will cause a rugby player to feel that he can no longer play and will continue to think of retiring. Other than that, other effect is your knee will be unstable. Some patients with a full ACL tear are unable to play sports that require cutting or turning, while others experience instability even when performing everyday tasks like walking. Rare people can engage in sporting activities without exhibiting any instability signs. Knee instability can be caused by damage to the supporting ligaments of the knee, osteoarthritis, or mechanical problems. It may occur after an injury or for no reason at all. That is the effect of ACL to the rugby players. Okay, next I will explain about the pathology, cause and effect of the second injury, which is hamstring strain injury. An excessive stretching or tearing of the muscle fibers and associated tissues cause a hamstring strain. Hamstring strain can happen anywhere along the muscle's length or at one of the attachment points. They can be graded as first, second, and third degree hamstring strain, with grade 3 being the most serious. So, when a hamstring muscle is pulled, it typically manifests as a sudden pain in the back of the thigh while sprinting or running quickly. Although hamstring strain frequently happen while sprinting, they can also happen while jumping or engaging in other activities that require quick start and stop, which is soccer, football, rugby, baseball, basketball, water skiing, and many track and field events are high-risk sports for hamstring strain. Running is a repetitive sport, so runners are particularly prone to chronic hamstring strain. The risk of hamstring strain is also increased when there is an imbalance in the hamstring and quadricep muscles' relative strength. So that is what causes the hamstring strain for the athlete. Next, the effect of the hamstring strain injury. Muscle strains are classified as mild, moderate, or severe. The length of recovery time grows in proportion to the severity of the strain. The first one is first degree, which is mild. This is the most common and typically minor injury. This injury is a pulled muscle with less than 5% structural disruption. After a first degree injury, you can expect to return to sport in 1 to 3 weeks. The second one is second degree, which is moderate. This damage consists of a larger but incomplete muscle tear. You will need to rest and recover for 3 to 6 weeks after this partial muscle tear before you can resume your full activity. The third one is third degree, which is severe. As a result of this injury, the muscle tendon unit is completely torn. As a result, a third degree muscle strain may require several weeks or months to recover fully. That is the effect of hamstring strain injury to the player. Okay, lastly, I will explain about the pathology, cause and effect of the ankle sprain injury. An ankle sprain occurs when the strong ligaments that support the ankle stretch beyond their limits and tear. The severity of a sprain depends on the number of ligaments affected as well as the extent to which the ligaments are ripped. The majority of sprains may be treated conservatively with ice, elevation, over-the-counter medicine, and also basic rehabilitation activities. However, if your ankle remains swollen or painful after many weeks of conservative therapy, or if you have trouble placing weight on your ankle, you should be checked to verify that you do not have a serious ankle sprain or fracture. If your symptoms persist despite non-surgical therapy, you may require surgery to repair or reconstruct the torn ligaments. A prolonged or untreated severe sprain can weaken your ankle making it more likely that you will damage it again if not treated and rehab properly. So repeated ankle sprain can result in long-term complications such as a persistent ankle discomfort, arthritis, and also instability. So, ankle joint is made up by three bones, which is tibia, shin bone that located at the ankle bone, and also fibula that located out of the lower leg, and outside ankle bone and talus located at the deep ankle bone. Ankle ligaments connect bone to bone and passively inhibit mobility at each point. These ligaments guarantee a robust, secure joint that not only work as a shock absorber but also support for your entire body when moving, but also permit enough movement for function such as running and leaping. There seem to be 3 ligaments on the outside of your ankle that might be injured if you roll on your ankle. You may feel swelling, bruising, and ankle discomfort at the moment of the injury, as well as a popping or cracking sound. It is frequently quite painful over the torn ligament. You may have difficulty walking or standing on your foot depending on the degree of your ankle sprain. In more severe circumstances, you may have intense pain deep in the joint as a result of a fracture or pain between your lower shin bones as a result of a high ankle sprain or syndesmosis sprain. For signs and symptoms of ankle sprain is depending on the injury, which is slight impact or heavy impact when the accident occurs. These signs and symptoms of sprained ankle might include pain around the bare leg on the affected foot, tenderness when touching the ankle, swelling, bruising, limited range of motion, instability of the ankle, and also popping sensation or sound when the injury is happening. Risk factor when the ankle sprain injury happen to the rugby athlete, which is precipitation may be limited to this injury athlete to them for participate in the training or even competing. This is because the athlete will have a limited movement of ankle to sprint or even moving further, while it can risk the injury even worse. So that is the pathology, cause and effect for the ankle sprain injury.
For ACL injury, I choose heel slides for the initial stage. First, take a towel and put it over your foot, and then pull it and bend your knee slowly as far as you can, and then pull it for 3 to 5 seconds. Then strengthen your knee slowly back. Repeat this for 2 sets and 10 repetitions. For the intermediate stage for ACL, I choose single leg squat for the exercise. So this is how you perform the single leg squat. Make sure your knee is 90 degrees. Do this for 8 to 10 repetitions and 2 sets for both legs.
Assalamualaikum warahmatullahi wabarakatuh. So I will present for rehabilitation in ACL injuries stage 3, which is advanced stage. So the exercise that we can apply is single leg landing and deceleration. So I will demonstrate. So when we apply this exercise, it will recover our ACL injuries for both legs, which is 1 set. Do it for 10 repetitions for 5 sets. So that's all from me. So lastly, for the return to sport stage in ACL injuries for rugby, I have found a rehabilitation exercise that we can apply. So very simple, use one of your legs. For example, the injuries in our right leg. Okay, use one leg, jump in three corners. For example, like this. Okay, do it for 5 repetition, one lap, 5 repetition, and then switch direction. Okay, like that. Okay.
So in order to do straight leg hamstring stretch, firstly you have to place your foot on a table or similar and lean into the stretch. Second step is to keep your leg straight and chest up. Next, take the stretch as far as is comfortable and hold. Relax into the stretch. So as a guide, perform 3 sets of 10 to 15 seconds once or twice a day. The next exercise is standing knee flexion. So the first step is to stand on one leg and bend the other one using just gravity as resistance. The second step is to start gently and slowly to start with as an early stage exercise. Aim for 3 sets of 10 repetitions once a day, building to 4 sets of 20 reps. The last step is ankle weights can be used to increase the load further.
Okay, for advanced stage, I choose alternate hip extensions. Using a step or box to raise your elbows, alternate putting each heel to the floor. It is important to maintain good core stability and keep your hips and shoulders still. As your heel touch the ground, the gluteal muscle and hamstring have to work isometrically to keep your body stable. This works the hamstrings muscle in a position similar to how they are when sprinting or accelerating. For return to sport stage, I choose lunges with ball. This exercise strengthens the glutes, hamstring muscle and quadriceps muscle. Stand with your injured leg in a wide stand in front of the other, holding a medicine ball close to your chest. Drop down, moving your weight onto your front leg while dropping the back knee to the floor.
For initial stage, I choose a towel stretch exercise. This exercise, you need to sit on the floor with your leg stretched out in front of you. Hold the stretch for 15 to 30 seconds. For intermediate stage, I choose a one leg balance. Try to hold this for 20 to 30 seconds. For advanced stage, I choose heel raise. This exercise is you need to stand with your hand in front of you resting against the wall. Do about 10 of these at first and work up to 20 or more. For return to sport stage, I choose a lateral jump. For lateral jump, begin by perform 3 sets of 10 repetitions in each direction.